Hey there, y'all. So this is day 6, post-op vitrectomy, multiple retinal tears, retinal detachment, scleral buckle, lensectomy, and silicone oil implant. As you can see, my eye is bruising a little more and it's swollen. I think part of that is from being face down so much, and gravity pulls, and then the fluids, I think, pool in the tissue because it is pointed downward. My eye today, I've had a lot of pain right through here and around my temple, all in here and behind that eye. That kind of started last night and continued into today. It is controlled with Advil or Tylenol, so it's fairly well controlled. It's just very uncomfortable. And I Googled, which I know you're not supposed to Google, but I did. And it says that is a normal type of pain as your eye heals from this complex of a surgery. Mine, they actually got in there and found a couple of things that needed to be done that they didn't realize they were going to have to do. But my eye the bruising is starting to turn yellow, and this right here is about as far open as I can open my eye on its own. I can open that lid, but it's still pretty disgusting. Yeah, that's all I need is to poke myself in the eyeball. But yeah, it's still kind of looks like pulverized hamburger meat. And I don't have a lens. And it had I'm assuming from the oil, not the oil, the gas. The gas caused a really bad cataract, and when the surgeon got in there, when we were in the OR, he couldn't see through that lens to repair the retina. So he had to do a lensectomy. And so now I'm left with no lens, and I can't have lens replacement surgery until the retina heals. And so, apparently I can go back to work in about between 2 to 3 weeks, but I have to wear an eye patch, and I'll have to wear that eye patch until I heal enough in possibly 6 to 8 weeks to get my lens replacement surgery. This has just turned into a huge ordeal. Like, I had 4 in-office surgeries. I had the first one that injected the gas bubble. The second, third, and fourth were extensive laser surgery, and none of those 3 fixed the problem. So everybody started running around when they realized that things were getting much worse, much more quickly than they expected. So this was on Tuesday afternoon late, and by Wednesday morning at 6 o'clock I was in surgery, waiting to be wheeled back to the OR. So things can rapidly decline. I wouldn't wish this on my worst enemy, or anybody for that matter, but you will get through it. Hang in there. Right now I deal with frustration at having to be on my face all the time, and I can be up like 2.5 hours out of a 24-hour time period. And that's pretty hard to do. I mean, I got things to do. It's nice out. It is warm. It's sunny, and I just want to be out. Of course, I can't wear makeup for like 2 weeks. That's neither here nor there. I like to wear my makeup, but that's not the important thing in the grand scheme of all this. But I will say it will try your patience, but you have to do what the doctor says. You have to follow the instructions, or you could have to go through this all over again. And I certainly don't want that. So I'm trying to do what I'm supposed to do with my head down as much as possible. If I'm sitting up, I've got my head down. Maybe looking at my phone or looking at a book. I don't watch much TV because it hurts to look up, and you're not really supposed to look up anyway yet. So I have been watching a lot or listening to a lot of documentaries on YouTube that I don't necessarily have to look at. I can just listen to them. I've got some Audible books, and I've got some paperback books here with my little book light. And so there's lots of ways to pass the time, but it gets boring after a little while. I'd much rather be at work with my patients and just spending time with my lab girls and all my people at Premier. And this has just been really difficult for somebody like me who likes to get out and go. I'm not a very good patient, but people in healthcare very rarely make good patients. That's just the general consensus. But I know I look terrible, but it is what it is. This too shall pass. I look like I've been in a bar fight, but I lost, by the way. Or maybe I won. I don't know. It depends on if I get all my vision back in my right eye or not. I'm praying for that. But yeah, in the meantime, I'm going to go take some more Advil and get this eye to settle back down. I need to rest it for a while. I've been sitting up for a little while, and I need to rest my eye. But I hope if you're going through this too, that you're not struggling, that you're not having any issues, and I hope this will be encouraging that it's all going to be okay. No matter what, it's going to be okay. It's just a bump in the road, and we have to get through it, and the only way to get past it is to go through it. You can't go over it or around it. You got to go through it. And with God's help, I'm strong. And it's like my great niece says, I am strong. I am smart. She's the most precious little girl in the whole world. And she has inspired me throughout all of this. And I just keep praying, Lord, you make me strong. I am strong because of you. I am strong. I am strong. I am strong. And the words out of a sweet little 3-year-old's mouth have been such a blessing to me during this time, to remind me that I am strong because it is God who makes me strong, and the Holy Spirit that lives within me. You just have to hang in there. This too shall pass. We're going to get through this, and this didn't catch our God by surprise. It caught us by surprise, but He knew long before now what we would face, and He will provide our needs and will take care of us. Just put it all in His hands and trust that He will carry you through as well. If you're watching this, I pray that you're not having to go through this right now, but if you are going through this or you're facing this coming up, just know that you're going to get through it. You just have to put your head down and just push through. But that's all I got for today. I pray you have a good, restful night, and I'll see you tomorrow. Thank you. Bye.